One of our presentations at San Antonio looked at blood-based tumor mutational burden and copy number changes across the genome. The idea behind this project was to look at changes in the blood that may identify a subset of patients who receive first-line treatment for metastatic HR-positive, HER2-negative breast cancer who may not respond optimally to therapy. And the idea behind blood tumor mutational burden is that the measure was first evaluated in lung cancer. And the idea behind tumor mutational burden is that having more mutations potentially is associated with increased what are called neoantigens, which are associated with response to immunotherapy, such as immune checkpoint inhibitors. And what we wanted to do was extend this work into blood, which there has been some data, particularly in lung cancer, looking at this in the past. But we wanted to specifically look at this in relation to patients both at baseline and at the time of clinical progression for patients treated with endocrine therapy and CDK4/6 inhibitors. And what we found, which was quite interesting, is that we could identify a subset of patients at baseline who did not derive what's called clinical benefit from standard first-line treatment, as well as patients who had shorter progression-free survival based on a baseline blood tumor mutational burden. So what we found in our study is that patients who had higher blood TMB had shorter progression-free survival for patients treated with CDK4/6 inhibitors and endocrine